So, thank you all so much for joining us today. It's Giving Tuesday, and this is Hampshire and Isle of Wight Community Foundation's Community Lens webinar. For those who don't know me, I'm Jacqui Scott and I'm Chief Executive of the Community Foundation. And I am delighted to welcome our four guests today. Firstly, Zoe Grant, Charity Manager of Breakout Youth.
Hi, lovely to be here. Sorry for the croaky coffee voice in advance.
My sympathies. Helen Hamblen, Chief Executive of Dementia Support Hampshire and Isle of Wight.
Hello.
Joanna Smith, Operations Director of Friends of the Family Winchester.
Hello.
And Alex Kenchington, Co-founder and Director of Bridge to Unity.
Hi guys, great to be here. Thanks, Jacqui.
Thank you, everyone. So just before we kick off, I need to cover the housekeeping messages. So as you will have heard, the session is being recorded and it will be made available through our socials and YouTube in the coming days. We ask all the audience to remain muted and cameras off and keep that way throughout. But we do very much want to take your questions, so please use the chat function for that. Give your name with a question just in case it doesn't come up when you send the message, and we'll cover as many questions as we can in the time available. So please just start asking the questions whenever you're ready. On the call today, my colleagues Sarah Bordley and Millie Moss, and they'll be monitoring the chat and the waiting room. So if you have any queries, don't hesitate to direct message them using the chat. So I think that covers all the housekeeping. So now we can move on to why you're all here today, which is the talking about resilience in challenging times. Well, my goodness, the times are challenging. I'm not sure the world's ever faced such a kind of permy-poly crisis and huge technological change in such a short space of time. We're living through extraordinarily challenging times, active conflicts in Europe, Africa, and the Middle East, tensions in Asia and South America. We've seen the rise of a tiny handful of companies gaining a type of global dominance never before seen, and new technologies which may or may not change the fundamentals of our societies. Closer to home, we've got tricky economic situation, both nationally and for our local authorities, increasing pressure on public services, with local government reorganisation and devolution on the horizon for our region. And at the same time, we're seeing division in our own communities, making the funding we provide at the Community Foundation more vital, working for social cohesion. In our charitable sector, well, community groups are still struggling with fewer volunteers post-COVID, smaller and more competitive pots of funding, and increased costs like national insurance contributions. And many groups are facing challenging or negative public discourse about the very people that they are here to support. And those people are often seeking their help for more complex issues than ever before. And of course, many people in our communities are simply still struggling with the ongoing cost of living crisis. Certainly the message we hear from our community groups every day is that things are tough and they just look like they're going to get tougher. So I don't think or feel that we would be able to provide a resolution to any of these issues here today. But I hope we can begin to lift a lid on what it's like for the community groups on the front line and the people that they serve, and how our guests and their community groups are responding. So Zoe, I'm going to turn to you first. So Breakout Youth works with LGBTQ plus young people.
Yep.
For those of you who are listening, I'm going to try and get this right, Zoe. If you're not familiar with that term, it stands for lesbian, gay, bisexual, transgender, and either queer or questioning, depending on how you feel about the first of those two keywords.
Yeah.
Zoe, how would you characterize the situation now for the young people you're working with? I imagine some of them are quite affected by some of this negative public discourse.
Yeah, it's very interesting. So I think young people have a difficult time anyway, but when you add in sort of an extra level of LGBTQ plus and thinking about the isolation and loneliness, especially when you come out of the back of COVID, a lot of young people miss school, they miss those opportunities to learn how to interact and engage and manage emotions, and became really isolated and maybe use some of that positive and negative tech of social media. But then we add on another layer of basically anti-trans rhetoric, and it impacts obviously non-binary, gender questioning, trans young people, but it impacts all LGBTQ plus young people because the anti-trans rhetoric brings up a real hostile environment for all of the community. And we have to remember that not people don't just fit into one nice slot, you know. Often you're not just a non-binary person or a trans person. You might have some sexual identity stuff that goes with it as well. So there is crossover. A lot of our young people are finding it really, really difficult. Coming to us with more need and reporting of hate crime, of feeling isolated, of fear of going out, fear for their personal safety, especially when it's coming into winter. You know, that really restricts. If you look at some of the Supreme Court and the AHRC stuff that's been going on, you know, when somebody feels like they can't go out and use a toilet or a public space, you know, that's a general basic human right, isn't it? And actually, we're stopping. You know, we are not stopping. We're not doing anything, but you know, people feel stopped to do that. And that has so many ripples around self-esteem and confidence, employment, uh, going to education, you know, succeeding in education, strain on family. It makes people go back to internalizing what their identity is. And actually, you know, if we look at the LGB part of the words, you know, some people sort of think, you know, well, why are we worried about that? Well, actually, we had Section 28 and in the sort of the 90s time where people couldn't talk about sexuality. And it feels a little bit like, you know, people internalize, and that's no good for anybody because you can never come to terms with who you are if you're just spinning it around in your own head. So I think it's really challenging. We've seen an increase of mental health, suicide ideation, suiciding. You know, it's really, really, really difficult. And I could add one little term, and sorry, everybody, I talk for England. I think we often talk about lived experience for staff and volunteers, but actually the staff and volunteers at Breakout all are living the experience. So it's not a case of they were homeless once, they can go back to a nice warm home now, but they could empathise to what it was like to not have a safe space to live. You know, they're living through this every day in their personal lives, in their family lives, in their work lives, and it's quite exhausting, I think. So I think you need to look at the ripples that from every single direction, and they are many.
Yeah. And it strikes me that what you're describing, even if that young person comes from the most secure, most stable, most loving home, they're still dealing with all of that stuff that's outside of that. And even with, you know, the right support.
They've still got to go outside and engage in the world. You know, they don't have to. They can sit and live in their bedrooms forever, but that
Yeah.
doesn't make a productive member of society, does it? And
Yeah.
we want everybody to be a productive member of society, no matter what your
Yeah.
gender, sexuality, age is. So, you know,
Yeah.
it's really, really difficult.
Yeah. Thanks, Zoe. Going to move on to
Welcome.
you, Helen, which, you know, you're working with people at a very different moment in their lives than what Zoe and her team are, for example. So perhaps you could try and sort of shine a light on how Dementia Support Hampshire and Isle of Wight are coping with the increasing need from clients against a backdrop of whether or not the funding available for care is right for the need that's out here. Funding is always a big issue.
Yeah, no, absolutely. So we're seeing a big increase in the need for our services, and especially because of the financial pressures on the local authority. So Hampshire County Council decommissioned their dementia advice service at the end of last year. And whilst we can support people in the group environment, we don't have the resource or the funding to be able to, you know, to replace the service that was there. I think there was something like 16 plus dementia advisors working in the community and able to do home visits and to assist people and prepare people for the future. Whilst, you know, we're a full-time equivalent of 3 people with a
Gosh.
large team of, you know, volunteers that help at our support groups. And we can support people in the group environment, and actually peer support is very therapeutic. Meeting others going through the same experience helps people to feel less lonely. People build their own support networks. So what we're doing, you know, is really vital. But for those that can't come to the group because of their mobility, or because they don't want to come to the group environment, or because of public transport issues, or for whatever reason, then there is, you know, no service there now to support those people in the home environment. We do have a helpline and we do support some of those people over the phone, but again, you know, that face to face and supporting people where they need to be supported, it is much more difficult now. And it's, you know, supporting people in the community with dementia, it's a long journey, and for the carers, without the support, they can, you know, fairly quickly burn out and reach crisis point, which means hospital admissions, which means that, you know, over the long term, not having that early support in the community will end up costing the wider system more in the long run. Supporting people with much higher needs because they've not had those early interventions. So it's a very, very difficult landscape for people living with dementia at the moment. You know, we're filling as much as the gap as we can, but we you know, we need more funds, as do so many other organisations, to be able to fully support people and for it to be sustainable. So we're just 3.5 years old, coming up to 4 years in February. And we've been really lucky to have a 3-year National Lottery grant to pay for staff salaries. But at the end of that 3 years, we have 1 more year. If we cannot replace that funding, then we can't continue. So that's a real worry long term.
Yeah. I'm sure we're going to touch on the question of sustainability again, Helen, in this conversation. Thanks so much. That really struck me that, you know, there had been 16 people working on that advice service, and now with that gone and you're only 3 people, you can't possibly meet that kind of demand. Alex, Bridge to Unity are working with refugees and asylum seekers. And so you're used to, you know, looping back to the kind of issues that Zoe was bringing up. You're used to dealing with negative public discourse daily. Can you say a little bit about how you and your team deal with that?
So you're definitely right. Obviously, we're serving a population of people that I think in the world we're living in at the moment, particularly in this country, there's a huge amount of forces trying to divide people and separate people and create more and more division between groups of people. And I think a lot of that is to do with this kind of rise in social media and negative public discourse and factually incorrect information that's being shared and distributed on the likes of TikTok, Facebook, this kind of perhaps not regulated correctly platforms. And then that obviously creates a huge amount of issues for the people that we serve and support. So it's a common occurrence that almost weekly we're seeing people who are scared to send their children to school because they're being attacked on the school bus or being attacked on the way home, or don't want to go to work themselves because they're being discriminated against specifically because the colour of their skin, their religious background, their kind of how they've come to be in this country. And, you know, we see the huge impact that has on people. And it is largely because of this kind of unhelpful narrative that's being spread on social media and through, you know, even in official news channels. And I guess for us, the way we've kind of tried to deal with that is to try and change the narrative, reshape the narrative, use stories and articles on our websites and our socials to try and actually change people's, you know, thoughts and opinions on individuals and groups of people. We regularly go into schools and deliver presentations about kind of what is a refugee, what is an asylum seeker, and actually trying to change those negative thoughts and those factually incorrect things about why these people are here and why we need to help them and what they've been through and how that might feel if you were put in their situation, to kind of change people's mindsets, and trying to do that from a young age, because obviously we know that a lot of these thoughts and things, they come from things people hear at home and in the family life. So trying to just kind of educate people from a young age. And as well as that, we do a huge amount of community engagement. So we run community kitchens where we invite different individuals from different cultures to come together and invite members of the public to kind of share food, share stories. We do community events where we invite our refugee and asylum seeker communities, but also the local communities as well, and do, you know, games of rounders and basketball and things to just bring people together, so to kind of emphasize that actually we are all people and human beings just trying to kind of make our way in life and keep our families safe. And just rather than trying to focus on the negative, we support people with the negative when they're experiencing it, but also just kind of try and change the narrative and myth bust and go about it that way.
Yeah, thanks, Alex, so much. You're a tiny community group in Gosport, though, right? And it's a big issue that's not only in our country,
Yeah.
absolutely. Thanks so much, Alex. And Joanna, just moving on to you, if you could just, friends of the family at Winchester are working with families who are really struggling with their family
Mhm.
lives, and that could be for lots and lots of different reasons for each individual family. But interestingly, you're based in an area, Winchester, which is seen as wealthy and comfortable and charming. So how do
Mhm.
you deal with that contrast daily, and how do you get the message out to your supporters that that need is really there?
Yeah, it's a really good question. And, we've been around 30 years in Winchester, and I think comes up time and time again. We are perceived as being an affluent city, and I think, first of all, it's for us to be clear on what the need is. And we know there is a need because people tell us. We know there's a need because we had 70 referrals to our mums and young children's group in the last 2 years, which, for a small town and a very small charity is a good number. And our families tell us. So actually a quote that we often use is a family said to us, "It's not easy to be poor in Winchester."
Mm,
And in many ways, I think I mean, you can arguably it's hard to be poor anywhere, but in a town where you are surrounded by affluence and this and that and nice shops, I think you stand out more, and it's a difficult environment. So I think, first of all, for us, knowing the need and being very clear on that need in all our narrative is really important. Um, as to how we get the message out about the need, I think as a charity, it's up to us to challenge those perceptions. And I think we try to resonate with people ultimately. Everyone has a family. Imagine you are, single parent, 4 kids, difficult behaviors, maybe you've got a background of trauma and abuse. You've got no garden, la 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 la. You can't get childcare to go for counselling. So I think it's about trying to resonate with the family to because I think everyone can relate to family, whatever, the blended modern approach is.
mm.
Everyone can resonate with that somewhere. And I think it's putting it in context for that person. So depending on who we're talking to, they will have different motivations for being interested in us. So it's about talking to the right people about what they're interested in to get across what our need is, and therefore what we might need, whether that's funding or just a bit of word of mouth, or just let us know you're here. We all know that the new thing, and people need to hear things 7 times before they action stuff nowadays. It used to be 3. So I think it's about consistency. So being consistent in our message, knowing the need, working with people and sharing the impact as much as possible. Often for us as a small charity, impacts can be small, but they can be huge for those families. So it's the mum that sort of says, "Oh, I didn't respond with anger when something happened at home," or the little boy that's getting respite from poorly parents once a week with a befriender. So I think it's about talking about that and sharing that, and just constantly drip feeding that in whatever capacity that might be. We're all small charities. None of us have huge marketing budgets, and I think it's about being present to the people that are already engaged and just being consistent. And I think I'm very passionate, and our team are very passionate, and because we're small grassroots, you see that every day. You're not 2 or 3 steps removed in an office, perhaps, and I think that really helps with being able to articulate the need to whoever needs to hear it.
I'm not sure if I'm really allowed to say this, but I've often thought that question you said, Joanna, I think it was that the impacts can be small, but it's big for that family. I often think, isn't that kind of the point? Sometimes
Yeah.
there's such a huge expectation on the charitable sector to measure our impact and talk about our impact all the time. And despite the fact that nobody has really agreed on what that actually means and how you do that, but that, sometimes isn't it good enough that one person's life has been changed, that, and sometimes well, I'm going to throw this to the floor, but sometimes the complexity of the situation that you're all on the front line of can be so much that actually it's almost impossible to measure what the difference that you've made is. But it could be that you've just helped somebody, work through how they need to access their GP because they couldn't get an appointment, or work through how to hold a conversation with the head teacher at school because they're worried that their kid is being bullied because they're gay or because they're, a refugee family or whatever. And that can be such a big difference in one family's life, right? And actually, the other thing that I thought was quite interesting, Joanna, I think you mentioned it, everybody's got a family. I think that's kind of the theme of what I'm hearing you all say. It's about humanizing your clients and saying, we're, there, but for the grace of God, go any one of us where, we could all be in that situation one way or another. And I've already asked 2 questions and I haven't really pinned down one question for you to talk about, but maybe that thing about kind of the tiny steps that you can take. Zoe, did you have a thought around that? The tiny successes?
Absolutely. So I'm 50 and I started as a youth worker in 1998 or something hideous like that in the last century. And one of the things I learned
It
early
really was
on,
the last century too, Zoe.
it was, I know, it feels so bad.
Genuinely was.
Thank goodness for hair dye. One of the things I learned really early on is that actually you can look at a group of people and what success looks like for one person is exceedingly different to somebody else. So, for example, and I carry that through now. So whenever I talk to my youth workers about setting goals and targets and action plans, to really think we are privileged to be able to get to know our young people so well, because it's a long-term relationship. It's not 6 sessions and you're gone. We've had young people come to us for 10 years. So I had a young person in the forest area who really wanted to get a job, very terrible transport options, had never been on a train and was so anxious about it. So actually our youth worker just took them on the train, 2 stops, worked out how to read the timetable, how to work out what platform, and came back again. And they did that a couple of times, and that's real success. And yet we've got other young people that will happily get on a train to London and not blink an eye. And to them, that's every day. So actually their success is different. So I think it's really crucial for us to think, how do we measure those successes? Because they're so very, very different. And one of the things that funders always want is impact and outcomes. And that's really, really difficult, right? Because we are a small organisation. It's not always the easiest space in youth groups to do outcomes. How are you feeling today? Well, actually, if I feel terrible, then I'm going to need some extra work and we don't have the capacity in the youth group, etc. So it's really hard to do that. But one of the things I've been sort of thinking about is how to do that sort of brief case study to show those little bits of what change looks like for different people, because I think we lose sight of that. And I think, Joanna, you're really right. Being present with those people that we're supporting as a grassroots organisation is so important. So I still do a bit of youth work because I think it's important for me to still have a connection with the young people we're here to support and to serve. How can I know what young people want if I don't come and talk to them? I say that as if we're a massive organisation. We are 6 full-time equivalents covering the whole of Hampshire and the Isle of Wight. I'll let somebody else speak.
Well, actually, Helen, I was thinking that all might sound quite familiar for you, as the tiny little changes, the tiny thing that you've managed to help that family or that person with. That must feel quite a familiar story.
Yeah, absolutely. So we do lots of practical stuff with people that come along to our groups or over the phone and helping people fill in their attendance allowance claim forms, because quite often the carer is so emotionally drained and exhausted, they can't think straight. And then they get this huge application form, and to even just read through it, feels so overwhelming. Whereas actually, if you break it down, and a lot of the answers are tick boxes, and a lot of the questions are not relevant, so it's not as daunting as it initially looks. But if you're tired, exhausted, emotionally
and possibly
drained,
at the
it's
beginning
difficult.
of a cognitive impairment of your own, if you're older and, a carer for an elderly person with dementia, right?
Absolutely, because we support lots of families where both people have dementia. or one has dementia and one has cancer, and you've got one looking after the other, and then the other looking after, and then the families are involved and the grandchildren are involved, but they're working. And so whilst we're supporting people face to face in our groups and on our helpline, this is actually taking the pressure off the families of the next 2 generations down that have to go out to work, that have children that are going through stuff. So us filling in that form helps all 3 generations of that family and takes the pressure off of everybody. And it is just those little things. I had a telephone call earlier from somebody and was having a really difficult time. Her grandmother lives with her. Grandmother has dementia, but that's impacting on her whole family, her child, her husband who works from home, and everything else. And her mother is going crazy in the evening, in the sundowning period. And we talked about when do they close their curtains, because now it's the darker evenings. If her mother is looking at a reflection in the window, she may actually think there's somebody outside looking in. And it was just this sudden realization for this lady that it's like, oh my God, that's it. She keeps saying there's somebody outside. She wants to get out the front door. So it's something very, very small. But if she shuts the curtains as it gets dark, then that solves that problem for the whole evening. So, sometimes it is just the tiny things that make such a big difference.
Absolutely. I have a question from Sarah. Sarah, your question is just around the staff and volunteers of each of the organisations that we're hearing from, and really about how you carry this weight. How do you continue to offer the support to your clients when it can be quite a barrage? Alex, I'd be interested in hearing this from you, because you're very much on the front line with the people that you're working with, but it's in this context of a very difficult public environment for your client group.
So in terms of how it affects our clients or the staff,
how your team, your staff and volunteers kind of cope with that balance of hearing everything that's going on publicly, and then also obviously often quite intensive stuff with clients.
I think it can be really, really difficult. And I think at Bridge to Unity, it's myself and Matt which head it up, and we're not paid, so we're completely volunteer led. So everything we do, we're unpaid for it. And so that obviously in itself creates huge kind of stress and pressures, because we're doing it alongside families and full-time work in other aspects. So a lot of the time you're dealing with really, really stressful situations and really acute situations for some families, but you're kind of trying to do it alongside other things. And as well as that, our volunteers are often going into hotels where there's people outside shouting and waving flags, and that can be really,
and feels
really
dangerous.
It feels threatening, it feels dangerous. The clients are scared. They often feel scared. They sometimes feel nervous about even talking about the voluntary work that they do, because obviously you're sometimes met with huge amounts of negativity from family members or friends or members of the general public. And I think what is really important to all of us is that at the centre of what we're doing is something that we're all so passionate about. And I think on those days when it is really difficult and you're met with adversity, whether that's people writing silly things on your Facebook posts or sending you aggressive emails, all of which we get fairly regularly, you just have to stand strong in the knowledge that you're doing what sits morally right with you, and you see day to day the impact that you're having. And like you guys were saying, it doesn't have to be this huge big impact. It can just be helping this person to call British Gas and figure out their electricity bill, or we've had to help people get on public transport before, navigating a bus route when you don't speak any English, and actually just keeping in your heart that that's why you're doing those things, and remembering that actually the people that you're serving are those people, and just trying to kind of not focus on the negativity, but also trying to work to change that negative narrative as well, which is why we do go into schools, and going into schools where you've got a group of kind of British children, a group of, say, Afghan children that are fighting and bickering, and there's racial tension, and working with them over the course of a number of weeks and seeing the guards come down and actually realizing that they're all just 14-year-old boys that are all going through the same struggles. And actually when you break down the on paper your skin colour's this, your religion's this, your this, that actually they're very similar. They all like football or cricket, or they like video games. And actually that it's celebrating those small wins and focusing on how you can turn the negative, narratives into positives. And I think that's all we can do, because if we focused on the negative, you wouldn't get anywhere. And I think the only way you can change negative thoughts is to educate and continue pushing, the truth and your agenda and your morals, and just hope that at some point people listen.
Yeah, absolutely. Joanna, I imagine that feels quite familiar to you as well, that kind of making the small change and, respecting that, that everybody we're all the same underneath the clothes and the skin, aren't we? And you must be looking at that often as well.
Yeah, I think it's very humbling. Like, our office is a garden shed, and we run our mum's group in the garden, which I'm looking at. And over the other side of the wall is Pilgrim School.
Right. Gosh.
So it brings it into really stark contrast, that affluence that you talked about. And yeah, it's very humbling. And I think, we are all people, and we are all formed by our past experiences. And it's almost like luck of the draw, isn't it? And a lot of the stuff our mums deal with is the early childhood experiences, the adverse experiences, the trauma, and that's what they come to us with, and that's what we're there to help with. And really, we just want to walk alongside them, and sort of show them hope. And as you guys have been saying, drive them to the Basics Bank so they know where it is, take them to the vineyard for some clothing. And it's the little.
For those of you not in Winchester, the vineyard is not a vineyard. At first, yes. I thought you were about to say drive them to the vineyard for a glass of wine and a nut.
Yeah, no, that would be
vineyard, which is Basics Bank and the church, isn't it? Yeah.
So I think it is very humbling, and I constantly go home to my family and have to sometimes bite my tongue with my children. We're lucky, we're all lucky. But do you know what? I think what I've learned is actually their mums adore their kids. They do anything for them. They just don't, they've had such bad past. They don't, that they don't know how to help themselves. And we were talking earlier, my colleague Sam talks about building a scaffolding around them. So the child's being befriended, but the scaffolding is there. So we're there for a phone call to help them articulate how they're going to talk to social services, or do something, or advocate better for themselves, or raise a bit of self-awareness. So, and I think it is accumulation of all those little things over a very long period of time that can make a difference.
I find the parenting question quite interesting, really, because I think we all do bring, childhood lasts a lifetime, and we bring our own experiences to that, our own childhood experiences to that. And there isn't a right or wrong, right? Like, there's things, obviously there's a spectrum with lots of that stuff, but I often liken it to learning any other task. If nobody shows you how to do it well, how do you do it well? And I think that's often in, particularly where there's problems in the early years of having children.
Yeah.
If you didn't have that modeled, how are you ever going to do it?
Yeah.
That's why we need groups like yours surrounding those.
And a lot of mums come to us saying, I don't know how to do it, but I want to be better. And I think that in itself is lovely that there's that recognition.
Yeah, absolutely.
It's a good start, isn't it?
Yeah.
Can I just talk about staffing and things like that? So I touched on lived and living experience just now. I spend a lot of my time propping up the staff in a good way. So we have several layers of things that we have. So we have a clinical supervision. So all of our staff once a month get to spend in a group setting 2 hours with a trained therapist in a clinical supervision. And I have no idea what they talk about in this. So they talk about some work stuff. So they might talk about things that have triggered them in their work, or how things have impacted them, or ask for advice from each other about, if you had this experience, how can we help? But I'm also open to them to talk about things that I might be doing that I could learn about. And if that's the case and they get permission from the clinical supervisor, they might tell me those kind of things. But I also offer them one-to-one clinical supervision. So if they've got stuff going on that's in their personal lives impacting, this is good. This is a bit of a selfish way of looking at it. I need my staff to function. And actually, if I need to do other stuff to make them function and it costs me some money and a little bit of time, then I should do that because ultimately young people get a better outcome. So they can have one-to-one clinical supervision. We do peer support with each other. We have a teaming every other week and we do like a hive mind. We do well-being sessions with each other. We paint pottery. Our festive celebration is not going to be in a restaurant. It's specifically in a closed space where we don't have to engage with any of the public, because some of our staff volunteers do not conform to the visual norms, let's say. We'll do taskmaster activities, a potluck buffet, and just have a few hours just for trustees, volunteers, and staff just to come together and just relax in whatever way they choose to. We have a separate office. I have a little sofa in my office, and people often just sit, have a little sit down. And a lot of my staff are also neurodiverse and ADHD. Think about that intersectionality because no one's ever just one thing. I do a lot of allowances for their neurodiversity. So I have a member of staff that sometimes just sits under the desk. And you know, that's fine. You sit under the desk if you're overwhelmed. As long as we've done a bit of a health and safety check about it, I'm good with that. You know, if people they get extra well-being days like annual leave in case they need to take a time off, they can manage their own time as long as they're there for this fixed time of youth groups. They can manage their time however they choose to because ultimately they're adults, you know, and if it fits better with what they need. So I spend a lot of time making adjustments and putting these layers in place because I need the team to be functioning, and I need the team to be safe in their own spaces. Because ultimately, we want young people to have best outcome. If you've got somebody who's having a bit of a wobble team-wise, then that's not safe for them or for the young people, is it? So, yeah, but it takes a lot of resource, a lot of capacity, and a lot of thought. I spend a lot of time thinking about each individual team member and actually what they need.
Zoe, you've muted yourself, but
I can stop me talking, Jacqui.
I can hear Sarah, who asked the original question, her thinking how wonderful that is that you can offer that flexibility. I think that's really amazing, and I'm sensing that the rest of you might have different approaches that you each play with that. I just want to read a comment that Sarah has made out loud because I've made everybody be muted. Sarah's reminding you that your clients are often living in social housing, or if they are in social housing, not to forget that their landlord might also provide support services for them, but also that could help you. And for example, at Vivid, they have a financial inclusion team that can help with DSS benefit applications and so on. And I can speak for Vivid in that there's lots of different programs they have and ways that they can try to help community groups to help their clients and direct help with their clients. And there is a very lovely message from Sarah thanking you for the inspirational work you do. I want to ask another question, which is something that I think is for all of you to have a think about. But what do you think funders in particular most often misunderstand about what you need from them or what they're asking of you? Alex, you've unmuted, so I'm going to go to you first.
I was having a think about this earlier. I think obviously we're incredibly grateful for what you guys have done to fund us, as I'm sure everyone on this call is, that's received funding from yourselves. And I think Absolutely. It's in our experience, the funding we've had is always project focused, which is great because we have a project in mind. It allows us to fulfill a specific project. In the case of us last year and in the coming year, it's a hub where people can come and get support as a drop-in, which is obviously fantastic. But as I was saying earlier, we don't have paid full-time members of staff, so which is simply because we don't have the funding to do it. So we run purely on volunteers. Myself and Matt head up that group of volunteers, again on a voluntary basis. So we obviously have a huge amount of ongoing costs because you have simple things like rent for places, internet costs, web hosting, our designer that does our website, our phone lines, insurance, which is £1,000 a year, training and DBS checks and all these kind of things. And the way we get around it is that when obviously we put a funding bid in and we have staff costs, we will pay the bare minimum that we need to pay for volunteers, for mileage and things like that. But we donate our salary back into the charity. So we get paid it, but donate it back. Which allows us to have a float, essentially, to carry on working. So we have, you know, for a certain project, we might pay someone or employ someone to run something, but actually day to day, when we get funding from councils, we have to, essentially, that's the way we have to run it. So because otherwise we would have no float to go forward. And I think it sounds less kind of sexy to funders to fund you know, the internet and phone bills and insurance, because it doesn't sound that exciting, does it, to donors? You know, but actually those are the really essential costs that allow a charity to grow. And you know, if you can pay a very small basic salary to one person that can then focus, you know, 20 hours a week on building that charity, that's so important. And obviously, thankfully, British Unity has been able to grow because Matt and I are doing this from a place of love and a place of passion that we're both so passionate about, that we're willing to commit full-time hours to it with no pay. But actually, is that sustainable in the long term? And I guess it, you know, I think it, although it doesn't sound, I know it's more difficult to measure, and it probably doesn't sound as exciting to donors, which I really do appreciate. I think actually those things are so important to small charities, just those ongoing run costs that give you longevity and allow you to think further than just the next 3 months for this project that the council have given us this funding for. Or, you know, it's great, right, well, we can employ you for 3 months, but actually at the end of that 3 months, we don't really know what's going to happen. What do we do with you then? Or, you know, we can employ you for twice a week for this hub for a year, but actually what we'd really love to be able to do is employ you another 2 days a week to grow and do more work, but we haven't got the funding for that. And I think that being able to receive smaller pots of funding for kind of more just day-to-day running and longer projects would be so beneficial to us. I mean, I can only speak for us, but I know that would be so beneficial.
I think that issue with staffing is a real fundamental problem for the sector, right? Because you know, if people are employed on part-time basis, I mean, most people need more than a part-time salary to survive in this day and age, right?
We've been really lucky that we've had people, for the hub as an example, where it's, you know, 4 hours a week, every other week. We've been so lucky that we have people that are able to do that. But actually, that what we need is people, you know, the management and the day-to-day costs, which is so much more difficult to secure funding for.
Absolutely. And if you keep employing sessional workers, then they have to go off at the end of that contract. They have to go off to put food on the table for their own families. And so you can lose that in a 3-month gap in funding and so on.
Well, you're wasting resources, recruitment. Sorry, Helen, you're wasting resources, recruitment, training, and then you're losing all that skill that you've just invested all that time in. Senseless. Helen, sorry.
Which I was just about to say exactly the same, but you know, the time and the effort and the cost of recruiting and training and actually, you know, having people on you know, part-time just to be at the fixed sessions, and then not enough people from the admin perspective or the fundraising perspective, really makes it difficult to grow and support more people and be sustainable. And you know, we have lots of volunteers, amazing volunteers, but volunteers can't offer full-time commitment, high level responsibility, and that core funding for staff and operational costs is essential for sustainability and effective delivery, because you've got to have that continuity and you can't have that just with volunteers. And you know, short-term projects are nice, but are they actually going to deliver long-term benefit? Day to day, supporting people day in, day out, for some funders kind of seems a bit boring. But you know, but actually that is having the most impact. That's what gives the most impact. But you need core funding to do that.
That's how people understand what those essentials are. Sorry, I'm a talker, aren't I?
That's all right. So Peter
Alex, you go.
Peter mentioned in the chat that running costs are always part of delivering a service. And absolutely, obviously, when we do a funding bid for, I mean, I'm using the hub as an example because it's relevant here, but obviously we put the cost down for a laptop to run that service and, you know, renting a space to run that service, but it is purely can only be on that project. And obviously that's one part of what we do, and then you obviously have to get lots of different pots of funding from different places. And I think, you know, what Helen said, the core funding is often what small charities need, and to be able to grow. And, you know, when we do funding bids, they can take hours and hours and hours sometimes, and we're doing that with, you know, alongside our full-time jobs, which we don't mind doing because we're passionate about it. But actually, if we could employ someone on 20 hours a week to do that, as well as the kind of management stuff, it would be so helpful. And I think that's just the funding that's more difficult to secure.
Yeah, absolutely. I always say, I will let you speak, Zoe, don't worry.
Oh, I thought I'd use the hand.
I always say that the funding for most organizations, because they, you know, comes from all sorts of different places. It's like putting together a jigsaw puzzle where 3 of the pieces are missing and most of them are upside down and they're all torn, you know, because nothing quite fits exactly what you need, and you're kind of twisting yourselves into knots all of the time. I feel like there is more of a move for the bigger funders, the ones that are kind of engaging in the funder talks, that recognizing that kind of for core funding and relaxing restrictions and being more sort of open to having a conversation if things are going wrong and that sort of thing, that's moved. But I am also really aware it's still got quite a long way to go. Zoe, I'll let you speak.
I'll try to make it
sorry,
really
and
quick.
then I'm definitely letting Helen and Joanna speak.
Okay, I'm going to make it really quick. A lot of funders going to invite only as small organisations with probably not the swankiest websites. How do we get on the radar? I think that's an interesting thing for us to think about. Multi-year funding, I think, would give us sustainability and security. Outcome monitoring, you know, us being able to do good outcome monitoring and be able to communicate that. Reporting, let's have reporting that's proportional for the amount of money that we have been given. So I get National Lottery, I do 1 report a year. I get £3,000 from somebody else who I won't mention. I have to report every quarterly, and it's not even on the quarter. So it's not even in a quarter time,
You're
you know.
normally reporting on.
And that core cost is really important, because going back to that well-being of staff, you know, how else do I pay for clinical supervision? Because clinical supervision is not cheap. And the LGBT Consortium did a report very recently, this is my last point, about funding. And actually 10 pence in every £100 of funding goes towards LGBT organisations, which is tiny, really. I would imagine it's probably very similar to some of the things like refugee asylum seekers, dementia. You know, we're all fighting for the same money.
Yeah.
And it takes hours to do these application forms because they're all different. I am now actually going to mute myself.
Or I'll mute you. Helen and then Joanna.
Yeah, so yeah, just the same. And also I think for small frontline charities that are really delivering that frontline support, that ongoing support, and yet some of the bigger funders really, you know, give large amounts to the national charities which are still doing great work, but a lot of them don't actually deliver the frontline support. They just have the big voice on social media and TV advertising and, you know, a national helpline, but national helplines can't help with local information. And lots of those national helplines actually refer straight into us because they can't answer the questions of the people living in Hampshire. And yet, you know, we don't necessarily see any of that, you know, that big funding. And in terms,
we could have a whole other webinar on the difference between small and local and big and national, right?
Yeah. and I think sometimes you kind of think, you know, with the reporter, if you're having funding from so many different funders, that's so many different applications, that's so many different reports for the same, you know, funding project, you know, that the time it takes to do that, you know, is quite substantial. Whereas if you had one funder for this or one funder for that, or funders that just gave you money and trusted you to deliver that frontline support and that impact, because we demonstrate that in our annual reports and to the Charity Commission. And so sometimes you kind of think, you know, if we can just have the money and deliver what we say we're going to deliver, and then give you our annual report to demonstrate the impact that we've had, it would actually free up time to support more people.
Yeah. Yeah.
Mm.
Thanks, Helen. Joanna.
I don't really have anything huge to add, and just other than to agree with everyone. The sort of pressures that, constantly getting funding is like some of my team say it's like being on a bit of a hamster wheel, and you can never come off because you're always,
doing something
and
for the funder.
There's all all then going, well, what about next year? And I mean, we're trying to be a bit more like, let's ask for bit less, but for 2 years, just to take that, to be able to plan for the future, because it's like Alex was saying, like we want to know, we want to be here for the next 30 years, and we know, so how do we do that in the environment that we're in? Interestingly,
you carry on, Joanna, sorry.
No, I was just going to say we had funding from a large funder, and they've changed all their criteria, and it's about early years, so it fits one of our projects perfectly. And I think we have a very valuable project, but we don't live in an area that has a certain percentage poverty. We are too high, going back to your affluent question. So it's it's just, that's another avenue that's closed to us now. So we're going to have to be more creative. And
goes back to your point about it being difficult to be poor in a wealthy area. Yeah, 100%. I've just got a question from Dawn at Minstead. But before I ask Dawn's question, I'm just going to plant in each of your minds the last thing I would like each of you to say as we draw to a close. And I'm going to have to tell you, you've only got 30 seconds each to say it. I just want you to think about because I like to end this sort of thing with something that feels a bit hopeful, because there's a lot of really scary and difficult stuff for the sector at the moment. So I want you each to think of someone or one of your clients or a situation that's actually made you, you've been involved in it and it's made you go, yeah, this is why I'm doing it. If there's just one kind of example that you can give, because I think that's the kind of human passion and the power of what the sector is all about. So I'm going to plant that in your minds so you can think about that as I read out Dawn's question, which is just about how some of the people that each of our community groups support may also be getting support from other groups. And and this is to Zoe's point about intersectionality, nobody's ever just one thing. And would we be able to increase or provide even more effective support if there was more collaboration between community groups, e.g. for Minstead Trust, they may have someone with a learning disability who is also LGBT, or who may have dementia and so on, or all of those things, or be a refugee, all of those things. So, whether or not there's more possibility for collaboration, which I think, in fact, we had a wonderful session at the Minstead Trust recently, and that was precisely one of the questions that we were trying to get to, is how can there be more collaboration? So is there anyone who would like to just sort of pick up on that very briefly? I think collaboration is really important. I would also say it's also really hard.
Yeah, so we try and collaborate wherever we can. I think in some instances it works really well. In others, it can get quite complicated from funding perspectives, etc. But we have a partnership with SGN, so we do energy advice and home safety and fuel poverty, and then we make referrals into NEF, the National Energy Foundation, and Income Max, so debt advice services. We refer into the Princess Royal Trust for carers, for emergency planning and carer support, or into other organisations if they have admiral nurses in those areas, etc. And then home safety visits will refer into the Blue Lamp Trust. So we might refer in and support people and advocate for them with visits to the Citizens Advice. So wherever we can, we do try and collaborate. But when it comes to funding, it can be quite difficult. So it's working together and making sure that your clients are getting what they need. But it can be harder to actually do joint funding because of the funding. restrictions.
I don't know of many examples I can think of where joint funding has worked really effectively. It is really difficult. So I think actually sometimes what we think of as collaboration might be just being well networked and having really good, strong referral pathways, so that there is, that if you need to refer a client to somebody, who is at the other end of that phone or email address. So we're going to just quickly draw to a close, but before we do, I'm going to ask each of you to give your 30 seconds on something that's made you feel hopeful or glad that you're doing the work that you're doing. Who would like to go first? Alex, would you like to go first, because you're
okay,
off mute?
So I'll try and make this as quick as I can. We established ourselves back in 2021. Myself and Matt started visiting hotels after everyone was evacuated from Afghanistan. We've been visiting a hotel in Oxford, and there was a family there, a mother, a father, and 2 young children, one of which was a baby that had been kind of thrown over the wall at Kabul airport in Afghanistan and had to be taken away by British soldiers to get them safely on a plane, sort of the classic thing you see on the front of the newspaper. And I remember the family were there, and we'd been going back and forth and supporting them with things like clothes and trying to get them the things that they needed. And I remember I had my young baby with me, who was about 6 months old, and she had her little girl that was also about 6 months old. And it was largely men that were outside, but I took myself aside to sit and breastfeed my little boy, who was only little. And I remember this lady came over, obviously dressed completely different to me, didn't speak any English, and she sat down and smiled and started to feed her baby. And even though we couldn't speak each other's language, it was just that joint kind of appreciation that we were both mothers, and we were both just trying to look after our children and provide a safe life for our children. And it kind of, in that moment, it just ignited a fire in me and made me realize that actually this is the reason that we're doing what we're doing, to help these families. And we're all just men, women, trying to, give our families the best that we've got and children the best that we've got. And these are 2 children born in completely different worlds, but actually knowing that they were there and they were safe and we were helping them kind of gave me hope for their future. And actually they've now gone on, mum and dad speak fluent English, they're both working, the children are grown up, are in school. That little girl has started school this year in the same way that my son has, and their lives are completely different, and they're safe and they're happy. And I think it's just moments like that you realize actually that's why we're doing what we're doing.
Yeah, that's a really wonderful story. Thank you, Alex. Wow. Joanna, how about you?
I think the one that springs to mind with me is it was after the mums group, and a mum had come in, and it'd taken a while to sort of get through the gate and come along, and dealing with lots of things. And one of the volunteers overheard her having a conversation with one of the other attendees of the group, another mum, and they overheard her say, "But I don't have any friends." And this other mum just turned around and said, "Well, you do now."
Wow.
And I just think that's lovely.
Yeah. Done. That's job done there, isn't it? Amazing.
Yeah.
It's wonderful. Thank you. Zoe.
I'll try and be really quick. So obviously it's quite a negative space out there for LGBTQ+, and we do a lot of advocacy for young people. And we've got one young person, we've done lots of advocacy around some really challenging times in their lives. But we want to do something to celebrate. So we put on in partnership with John Hansard Gallery, an exhibition created by all of our youth groups. The point I'm trying to make here is we've done advocacy for this young person around all some really difficult times in their lives, but we had 2 young people design, deliver, curate. So they went to all the youth groups, they delivered the session plans, they helped young people make stuff, they worked with John Hansard Gallery to curate it. And it's the same young person that we did some work around challenging stuff. So advocacy, I think, can be positive as well as negative. And then we had a launch, because that's what you do with galleries and art stuff. And we had 80 people there. And those 2 young people sat and spoke to all 80 people. And it was funders, it was family, it was friends, it was young people. And just to be able to stand back and look and think, actually, it's not all negative out there. It's really easy to think it is all negative and it just weighs you down. But sometimes you have to make the opportunity for yourselves, your team, and your young people to kind of go, actually, no, we can do something that celebrates.
Yeah, wonderful. Wow. And yeah, you have to make that yourself. Thanks, Zoe. Helen.
So I actually think every single day that, everyone we speak to, it really just reinforces that what we're doing is so positive. And so one story, we helped a lady that hadn't had a dementia diagnosis, and she used to walk around the shopping centre every day, and her hair was all knotted, and her clothes were all dirty, and she came to the group this is right back in our early days in 2022, and we got to know her, and it was clear that she had a cognitive impairment, and we actually found out that she was living in a privately rented flat. She didn't have any gas, she didn't have any heating, she didn't have any hot water. And we spoke to social services with her permission, and they said that she is known to them, but they hadn't been able to move forward and help her because she was not very trusting of, you know, the system. So we advocated for, we sat with her at her care needs assessment, at her financial assessment. She's now housed in Vivid housing, and we helped social services to get all of that through and to get her moved, and she still comes to the group 3 years later, and she has a whole load of friends that, you know, she comes along to the, you know, the Christmas party, and she, you know, she always says that, you know, she didn't have a life before, and now she has a life and she has friends, and which is so lovely. But I think everything that we do for everybody that we support just changes the long-term narrative of their experience of living with dementia, because dementia is a long journey and it's really, really difficult and it wears you down. And when somebody's loved one dies at the end of their journey, the carer, the family, instead of looking back and saying, do you know what, that was the worst 5 years of my life, and finding it really hard to move forward because they, you know, they've given up their friends and their hobbies and everything for their care and responsibilities. Now they're continuing to come to the group and support other people that are going through the journey they've just been on. And they say that whilst it's been a difficult 5 years, actually they wouldn't have met all these wonderful people, they wouldn't have done all these things, and they wouldn't have had all these memories without coming together with our dementia community. And so just, it's not just impact now, it's a real long-term impact, and it makes their lives better beyond dementia as well, which, you know, which is really great.
Amazing. Thank you, Helen. Thank you so much. Well, we need to draw to a close. We're actually slightly over time. Thank you all so much for joining us and for talking about your different clients and experiences. I think the thing that has come through most strongly when we're talking about resilience in challenging times is that absolute passion and compassion that you and your teams are taking into your places of work or volunteering every single day. So thank you all so much for doing that. I hope that we, as one of your funders, have been able to make a small amount of difference in the small ways that we can. Thank you all so much for coming. Thank you to our audience, and we hope to see you soon for the next Community Lens webinar or podcast. And please do pass on to friends and colleagues and connections to sign up on our website for more. Thank you all so much for coming.